Hello everyone. Today I want us to look at the general nursing care. Okay. Welcome to this channel, Miss Kanji. I hope we'll be able to understand one or two things about how to write a general nursing care. Yeah. So this is in relation to an acronym known as a prophonema. Okay. So whenever you are writing your nursing care, remember to use a prophonema. A for EMS, E for environment, P position, R for rest, O for observation, P for psychological care, hygiene, exercise, nutrition, elimination, medication, and advice. So advice is your IEC. Now you should remember that with this acronym, as you are using your prophonema, you should also write it in relation to how many marks the nursing care or nursing management has. Nursing management or nursing care has 35 marks. So even if you are asked to write your part C in relation to, maybe if they phrase the question to say describe the management, okay, 50%. That 50% is always divided into 15 medical management, 35 nursing care or nursing management, okay. And then your nursing management, you have to write it in this form where you're going to use a prophonema. Then your aims out of the 35% is mostly 2 marks, okay. And then that 2 marks, you should write at least 3 aims and above, not 1, not 2. For you to get 2 marks, you need to write at least 3 aims. And then the other headings, you should make sure that you write at least 3, okay, 3 points per heading. So 3 points per heading with a rationale will give you 33 marks, plus the 2 marks for your aims, that is 35 marks. Okay, now you find that sometimes some headings like maybe exercise, rest, hygiene may not have enough marks. Maybe you don't have a lot to write on those headings. Now those headings, you find that headings like environment, psychological care, observations, there you may even write 4 or 5 points, at least maximum 5 points. Don't go beyond that. Okay, so if you write at least 4 to 5 points, it will cover up for the other marks where you are unable to write maybe under position, where you only have 1 or 2 positions, under exercise where you only have 1 or 2 points. Okay, so if you write maybe 4 headings under environment, 4 headings under observation, maybe 5 under psychological care, to cover up for the other headings which have less marks or which have less points. Okay, so those are some of the tips. Okay, so other headings that you can also add to the general nursing care headings at prophonema, you can have infection prevention. Okay, so this one can apply maybe to conditions like cholera, those conditions which are very infectious, like maybe coronavirus, or things like TB. Okay, infection prevention can also be the same as quarantine, where you quarantine and you try and prevent nosocomial infections. Okay, then you can also have fluid therapy. This one can apply maybe to burns, okay, or cholera, where a patient may lose fluids through vomiting and diarrhea, and then you need adequate fluids, okay, as your intervention. Then prevention of injury. This can come in conditions where the patient is maybe, for example, easily bruised, okay, or they are prone to convulsions. Make sure that the environment has no objects which can cause injury. Okay, then management of hypothermia in case of maybe burns, or if a child is hypothermic or is at risk of hypothermia, you can add a heading, management of hypothermia. Then wound care, if it were maybe under, let's say someone has got a wound, maybe under surgery, you can add such a heading. Then under eye care, if someone has got problem, condition to do with the eye, or has just come from surgery to do with the eye, you can have eye care. Then sometimes you have conditions, maybe like jaundice in a child, okay, in a baby, and they have, so you can have a heading such as phototherapy. Okay, now these headings you can add to the general nursing care to be more specific in relation to your heading. Okay, and I hope this will help. Okay, so we continue with the aims. So like I said, you need to add at least 3 aims and above for you to have 2 marks. Remember, your aims is 2 marks. So what is an aim? An aim is mostly what the nurse wants to achieve at the end of the care that is given to the patient. Okay, maybe the treatment you're giving, if you are rehabilitating, what do you want to achieve at the end of your care to the patient? Those are your aims. So examples of aim, you have to prevent acquisition of hospital-acquired infections, to allay anxiety, to prevent complications, to increase the oxygen carrying capacity of blood, to alleviate discomforts experienced by the patient, to improve the nutritional status of the patient, to help the patient achieve some daily living activities of daily living. Okay, so we have those aims, and then our next heading would be environment. Okay, now remember, the aims mostly they are related to your headings. Okay, just look at your headings. Like nutrition, you can say to improve nutritional status. Okay, maybe to help the patient ambulate if it's under exercise, something like that. So let them not be too hard for you to formulate, because just look at your headings and you'll be able to formulate those aims. Okay, then environment. Okay, so environment is the place where you want to, if you have a patient, you receive them and you admit them. Okay, now this environment, you should make sure that it is clean, well lit, ventilated, warm, noise free, and all that. Okay, so now how do you write your points under environment? Remember, as you write your points, you should put a correct rationale. Okay, put a rationale. Correct point with a correct rationale will gain you 1 mark. So make sure that you put rationales to every point that you write under each heading for you to get the correct mark. Okay, and maximum you should write under each heading at least 3 and above. 3 and above. If you can't manage to write 3, if you can just write 2, make sure that you maximize on the other headings. Okay, so those are some of the points. So I will nurse the patient in the general ward, but use reverse barrier nursing to prevent nosocomial infections. I will nurse the patient in a well and dusted and well ventilated room to prevent respiratory tract infections. Okay, then others, I will nurse the patient in a well lit room for easy observation and for orientation to time and place of the patient. Then I will include oxygen giving apparatus for the use if the patient is dyspneic. Then you can also say, I will include a drip stand in the room for intravenous infusion in case need arises. Now remember, all these points are just general. I just put them there. So you need to specify in relation to the condition you are nursing and the environment. Okay. Then we have position. So position, this is the position that the patient can assume, or if they can't assume it on their own, the nurse helps the patient to assume that position so that they are comfortable. Okay, then in certain conditions, the nurse will advise the patient which is the best position, because they know how certain symptoms can be alleviated. Okay, so for example, maybe recovery position and all that. So what are some of the examples under position? I will nurse my patient in Fowler's position to promote lung expansion and relieve dyspnea. So here, in case the patient has got dyspnea, maybe like in asthma or any other conditions related to the airway, you can put them in Fowler's position. Okay, I will nurse my patient. If my patient is unconscious, I will nurse my patient in a semi-recumbent position to promote drainage of secretions and avoid choking. Okay, I will change the patient's position 2 hourly to prevent development of pressure areas. Okay, development of pressure sores and pressure areas. So that can also be a point under. So maybe you put the patient in a certain position, then they should change. So that will make it like two points under position. Then others, as the condition improves, I will let my patient adopting position of comfort to promote rest. I'll provide necessary accessories such as backrest, pillows, fracture boards to help the patient maintain the desired position. Then under rest. Okay, rest. Here we want to make sure that the patient is in an area where there is no noise, okay, so that it helps them recover well. Sometimes if a patient maybe has a headache, for example, and they're in a noisy place, they might take long to recover. So we should make sure that they reserve the energy and all that, so that if they have any problems, they are resting at all times. Okay? So what do we need to write under rest? I will nurse my patient a quiet room to promote rest. I will play the radio at low volume to promote rest. I will answer all phones promptly to prevent disturbing the patient, thereby promoting rest. Then I will do related procedures in blocks to promote rest for the patient. Then I will administer prescribed analgesics in order to promote rest. I will ensure that squeaky trolleys are oiled to prevent noise and thereby promote rest. Okay, there are a lot of things you can write under rest. Okay, so those are just some of the things. I will make sure that there is no interrupted periods of rest, and assisting in turning and feeding to promote healing. Okay, I will encourage visiting for brief periods only in order to ensure rest, and then I will not involve patients in exhaustive activities in order to promote. Okay, now to our fifth part of our nursing care, that is observation. So under this, one of the points is I will do and observe vital signs to act as baseline data in order to know if the condition is improving or not. Now, you know that vital signs are things like temperature, pulse, respirations, and all that. So there's no need for you to spread them to say maybe I'll do temperature to do this, I'll do respirations to do this, I'll do pulse. No. When you say vital signs, they're already grouped. Okay, unless if the condition requires you to maybe separate those vital signs one by one per point. Okay, but otherwise when you use vital signs, that is enough. So I'll observe the patient for dyspnea. If present, I'll prop up the patient to promote lung expansion and relieve dyspnea. I'll observe the pressure areas if the patient is in an unconscious state, okay, to detect onset of pressure sore development. Then I will also take the patient's temperature to detect fever, which might indicate presence of infections. Okay. Alright, so others include I will observe the urine output in order to detect any abnormalities and monitor patient's response to the cure. I will observe the respirations to detect tachypnea and report accordingly. I will observe feeding pattern of the patient so as to give proper nutritional advice or interventions to the patient. Okay, then I'll observe the general condition of the patient so as to detect any abnormalities. I'll observe the color and texture of the hair in case of nutritional deficiencies. Then I'll observe the mental status of the patient and use a Glasgow scale to detect or to note any deviation from normal. Okay, then I'll observe any strange eye, vaginal, nasal, and ear discharge, which may indicate infection. If present, I will intervene by informing the physician and give antibiotics to eliminate the causative organism. Okay, then I will also observe if the patient is taking their drugs accordingly, as this will aid in healing. Okay, now we look at psychological care. Now, psychological care mostly deals with the psychological aspects of the patient, things like emotions, feelings, thoughts, and behaviors, and all that. You might find that the patient may be feeling maybe upset, have different thoughts, and all that. Mostly, this one is due to the new environment they are in, and maybe having less knowledge about the disease. Okay. So now what do we need to write under psychological care? So here you should make sure that you orient the patient to the ward and all the facilities around the ward to help them adapt quickly so that they know what is happening, so that they are aware and they are not left, they don't feel isolated and alone. Then you should also make sure that you assure the patient that the medical team is doing everything possible to make sure that they recover and so as to relate. Then others explain the disease process in order for you to for your patient's knowledge levels about the condition to be raised and thereby allay anxiety. Then encourage the patient to ask questions and also answer them accordingly. Okay, so that the patient is able to have enough knowledge, and if the patient is unable, if you are unable to answer those questions, you need to refer them to a physician. Okay, and explain all procedures to be done on the patient in order to gain cooperation and allay anxiety. Okay, so you've seen most of these. It's like we want to allay anxiety and all that. Okay, then involve a successfully managed case to come and talk to the patient in order to allow the patient to ask pressing questions and get answers, thereby as this will improve the patient's outlook on the condition. Then explain every procedure to the patient to gain their cooperation. Then allow the patient's loved ones, okay, in the care of the patient so as the patient feels loved and they don't feel alone or left out. Another one is hygiene. So hygiene, here we want to make sure that we prevent nosocomial infection spread either from patient to staff or from staff to patient. Okay, yeah. So what are we going to do here? Offer a bed bath to the patient, that is if the patient maybe is bedridden, okay, to promote comfort and remove dead epithelial cells. Then I will do hair care to prevent pediculosis. I will do nail care to prevent auto infections. I will do mouth care to prevent decay, tooth decay, and halitosis. I will change the linen to promote comfort. Okay. Others, I will encourage my patients to wash their hands whenever they use the toilet to prevent diarrhea diseases. Then I will empty urinals, remove vomiters, for clean bedpans to prevent bad odor on the ward, thereby promoting hygiene. Then do daily wound cleaning if the patient has a wound to promote healing and prevent bad odor in the ward. Okay. Then another one is exercise. So exercise, mostly we want to improve blood circulation. Okay, and nurses need to do this for the patient, or if the patient is able to do it, you can also advise them to do so. So this will help maintain and improve patients' physical, psychological, and emotional health. Okay, so what do we do under exercise? If patient is bedridden, I will help the patient to perform passive exercises to prevent deep vein thrombosis. Then as condition improves, I will advise the patient to do active exercises to promote blood circulation. I will teach my patient to do deep breathing exercises to prevent hypostatic pneumonia. Okay. Then I will do passive exercises on patients who are unconscious to prevent contractures and loss of function of some body parts. Then I will encourage my patient to be getting out of bed and walk around to prevent hypostatic pneumonia. That is after the patient improves. Okay, I will walk around with the weak patients as their supporter to prevent falls. And nutrition, here mostly we want to make sure that they take their drugs, okay, and their nutrition is also good as they are taking their drugs, okay, also to improve their health. Now what I'm going to do, I will give the patient a balanced meal to boost the immunity. I will give foods rich in carbohydrates such as sugar in order to provide energy. I will give the patient vegetables and fruits to provide the patient or the body of the patient vitamins to boost the immunity. I will give my patient foods rich in proteins to repair what and I will give my patient enough roughage, okay, to prevent constipation. Then I will encourage the patient to take a lot of water or fluids for hydration. Then if the patient is not able to feed orally, I will insert a nasogastric tube and an IV, okay. IV can also feed the patient via IV route to prevent malnutrition. Then elimination, this one helps the patient as you are eliminating. This one deals with the stool and the urine and all that. Now as you are doing that, you should make sure that you maintain privacy, okay, because sometimes you might do this in the ward where there are other patients. So this will help avoid the patient from being embarrassed, okay. So now what are you going to do? I will monitor fluid input and urine output to, okay, using a fluid balance chart to prevent fluid overload. Then if the patient is unable to pass urine, I will open nearby taps to promote urination as the sound of water from the tap stimulates urination. Then if that can't work, you need to catheterize the patient, okay. If the patient is having urine incontinence or dysuria, okay, to aid in urination, then offer a bedpan and urinal to prevent for the patients who are mostly bedridden, okay, or those who are weak. This will help them to prevent any undue stress, okay. Then provide privacy to prevent embarrassment, okay. Then we have medication. So under medication, you should make sure that you write it according to maybe the 5 rights, and then you monitor side effects and all that. Here you don't need to write doses. If you have in your question, if the question says describe the management, because you have already written the medical management, so here you just need to describe what you're going to do as a nurse, okay. So under this we can write, I will administer all prescribed drugs at the right time, at the right dose, right route, right frequency to promote recovery. I will give analgesics like paracetamol to relieve pain. I will give antibiotics like amoxicillin to eliminate the causative organism. Then I will monitor side effects of the drugs and discontinue if the side effects are severe, okay, to promote healing. Then I will explain to the patient the reasons for taking drugs and the importance of completing the dose to prevent drug resistance and recurrence of disease. Always give a rationale, okay. Then the last part is advice, okay. Now advice, what you're going to give, you find out a lot of patients have got different beliefs and traditions, and maybe they believe wrong things and all that. So this is the time where you need to correct things, okay, what they believe in, and also guide them on how to take care of themselves, as well as how to prevent infections and all that. Okay, so it will help change their behavior and maybe improve the problems that they are facing. So under these, you may write, I will emphasize to the patient on the need for personal hygiene to prevent hospital-acquired infections. Then I will educate the patient on the condition in order to raise their knowledge levels and promote cooperation. I'll educate the patient to follow the drug regime and as instructed by the physician in order to prevent drug resistance and promote recovery. Okay, then I will teach the patient preventive measures of the disease in order to avoid recurrence, teach the patient on signs and symptoms of the disease and early detection, okay, so that they seek care as soon as possible. Then advise the patient to seek medical care as quickly as possible and avoid looking for herbs to prevent complications. Then encourage the patient to come back if no improvement is felt after completing the course, so that further investigations can be done and another treatment regime can be started. Then encourage the patients with chronic conditions like asthma, epilepsy, cancer, and any others, okay, to move with identifiers, okay, which can help them be identified easily and avoid any complications. Okay, so if someone is diabetic, they can move with a band in case they're in an attack. People around can be able to know and rush them to the clinic as soon as possible. Then I will encourage the patient to be taking a balanced diet so as to promote healing, and if he or she is starving himself, I will advise the patient not to do so, as this can predispose to peptic ulcers. Then encourage the patient to change their lifestyle. For example, stopping to smoke. Okay, they can stop smoking if they do so to promote healing, as smoking may cause lung cancer and predispose to other ailments. Okay, we've come to the end of our PowerPoint presentation. Thank you very much for listening. I'm very grateful for all those people who keep subscribing. Please subscribe and share with others who need to learn. Okay, if you have a comment, if you have a question, leave a comment. I'll be able to find it. Thank you so much.